Again, my name is Manny. I oversee the Office of Primary Care and Rural Health here at RIDO, and it's a pleasure to have this time with you guys. I know this is your lunch hour. We appreciate your time to talk a little bit more about this program that we're so excited about, the Primary Care Training Sites program. With me is Sam Ogundari. Sam, if you could introduce yourself.
Everyone. My name is Sam. I am the program manager for the primary care training site program. I'm really excited that everyone came out to learn more about the program. If you have any questions throughout the presentation, feel free to drop them in the chat.
Awesome. So, again, as we were saying earlier, where people were joining, we are going to, this meeting is being recorded and we'll provide all the materials that we're going to go over today on our website. We will hope to put them up today, if not latest tomorrow. They will be there on our website for everybody to see. Um, so I'm going to share my screen now, and can I just get a thumbs up that everybody can see the slides, that first slide? Awesome. Thank you. All right. So um, our goal for today, again, is to provide a quick overview of the program, the application process. This is starting um, next week on Monday, and basically have some time with you to answer questions about the program. So a quick little uh, introductory slide here, our objectives. We're going to go over the program, talk about eligibility, talk a little bit about how awards will be determined, the application process, and kind of what we envision when sites are implementing this grant. So before starting, I want to kind of go over our program, our mission, our office, why we're here. Um, so the Office of Primary Care and Rural Health its mission is to address health disparities created by lack of access to high quality care due to financial, cultural, geographic barriers. We accomplish our mission by facilitating and coordinating activities within the state and our rural communities with a focus on delivering primary care services and the recruitment and retention of health professionals. We really go about our way to link communities with state and federal resources and collaborate with public and private agencies to meet the needs of Rhode Islanders and promote high quality health services. We do a lot in our office, and we're so happy that this program actually came to our office because it really aligns with our goals. As part of our office, and the work that we do in the primary care and rural health state office, this initiative that expands training opportunities for future primary care clinicians in community-based settings is vital. Programs like this, play a key role in developing a well-trained workforce by fostering clinical education within primary care settings, including those that provide comprehensive primary care settings to a lot of our underserved communities. So this really kind of ties into to the work we do in the Office of Primary Care and Rural Health. Now, particularly this program, the Primary Care Training Sites program, the is dedicated to enhancing and expanding Rhode Island's capacity to train the next generation of healthcare professionals. And I want to really emphasize that we are thinking about the capacity to train the next doctors, the next physician assistants, the next nurse practitioners that are going to take care of me and my children as they get older, as we get older. And through strategic grants, the primary care training sites incentivizes practices to expand their capacity to train students while supporting preceptors. A big part of it is supporting our preceptors who are our teachers, our mentors that are teaching the next generation of health professionals. The program seeks to enhance uh, training capacity, supporting high quality opportunities for medical students, residents, nurse practitioners, physician assistants, all the individuals that train in that primary care setting. A quick high level overview. This is like a 3,000 foot picture of the program. The primary care training sites program obviously is led by RIDO and the Office of Primary Care and Rural Health. Health expands clinical training in primary care settings by providing financial incentives to the training site, hosting the medical students, the residents, the fellows, the nurse practitioners, the physician assistants. So the grants go directly to the site. The program also encourages the site to develop a compensation model, and Sam will talk a little bit more about this as he goes into the next section. Um, that these compensation models to benefit the preceptors and improve the training capacity. I know our preceptors are the ones who are teaching. They are the ones who often have to carry the burden of also being a physician and practicing and providing care. And so the hope is that this will benefit those preceptors and the ability for them to increase capacity. It prioritizes rural and based sites, particularly those that are recognized as patient-centered medical homes by the NCQA, and those that integrate behavioral health services. A key partner to our program, and I want to give them a very special shout out because they've been great to us and have been awesome to work with. It's the Care Transformation Collaborative, which plays a key role in our shared goal of strengthening training opportunities through curriculum development, preceptor education, and learning collaboratives. So that said, I'm going to turn this over to Sam. And I know the folks are at CTC on a call. At one point during the presentation, I definitely want you to talk a little bit about the work that you guys are doing. It's been amazing to partner with Dr. Flanagan, Jolanda, Mike Mitchell Irving, Deb Herchowitz, and the whole team there. So thank you for your partnership in getting us to this point with the program. So Sam.
Thank you, Manny. I'll be walking you guys through the key aspects of the program, starting with eligibility requirements, how awards are determined, and the different compensation models available. Then we'll go over the application process, followed by what you can expect when it comes to implementing the grant. Next slide. To qualify for funding, sites must first provide primary care clinical training for interns, residents, or fellows as part of the required training for physicians, nurse practitioners, or physician assistants. Have and maintain an affiliation with accredited higher education institution for clinical training. Provide integrated behavioral health services, offer a collaborative team-based care environment where students gain experience working with diverse clinicians, hold recognition as a patient-centered medical home by the National Committee for Quality Assurance. The site also must be physically located in Rhode Island. And if a site does not meet all or most of these requirements, unfortunately, they probably won't be qualified. And I'll discuss this later in the presentation. Next slide.
Sam, before we go to the next slide, there was a quick question on the chat that I do want to address. And Karen, I'm going to read out the question just so that it's transcribed in the recording. It says we are part of the RICPIC, and RICPIC is an NCQA case management accreditation instead of PCMH. Would this be an acceptable recognition for this program? We are also recognized through OHIC as a PCMH. Unfortunately, at this point in the program, it is not. And that is because in the authorizing statute that provided this program, that allowed this program to participate, it was specified NCQA PCMH. That is something that we are exploring to figure out how we could do that. It is through a legislative process, but you are correct that it is a limiting factor. Go ahead, Sam.
Yep. I believe there's another question. What about training medical students? Why is it only interns and residents? Um, I believe that I did mention students, but okay. So I'll read it again. Provide primary care clinical training for interns, residents, or fellows as a part of the required training for physicians, nurse practitioners, or physician assistants. So this
But Sam, what
doesn't
about medical students?
Correct.
Medical students.
this yes, this does include medical students, correct, Manny?
Correct. So we're
Yep.
we're we're gonna have medical students, we're gonna have medical residents, we're gonna have nurse practitioner students, physician assistant students, and then fellows that, fellows obviously have completed their training, their at least basic training, but now are going for additional training. and those that pertain to physicians, nurse practitioners, and PAs, as long as the training is being done in the primary care setting, all those students are going to be covered within this program. And let me just move on to the next slide because you asked me to go ahead and say it.
Okay, so I believe that slide is the next slide, Manny.
Next one.
Yes. I'm still seeing the previous slide.
Should be seeing the NCQA recognition requirement.
Okay. NCQA, patient-centered medical home recognition, is a key eligibility requirement, and I just want to emphasize the expectations. So first, sites must be recognized as a patient-centered medical home by the National Committee for Quality Assurance and maintain this status through June 30th, uh, 2020, 2026. If NCQA recognition expires before June 30th, 2026, the program narrative must detail plans to maintain recognition throughout the program period. And I'll talk more about the project narrative and budget narrative as we go along. Sites in the process of obtaining NCQA recognition must appear on the NCQA approved site list by April 19th, 2025, before midnight of that day. Sites that do not meet this requirement are ineligible for funding and cannot enter into a contract with the program.
Sam and
One
Manny,
second.
we're not seeing the new slide. We're still
Yep,
seeing the is your site eligible slide.
I just saw that. So what I'll do is I'll stop sharing and I'll reshare it again to make sure that it's going through.
And I just want to, hi, everybody. I'm Yolanda Bose. I'm from CTCRI. I'm working with, I'm part of the team that's working with Manny and Sam on this project. And there has been some additional language submitted to the legislature for review that would amend the NCQA requirement to broaden the eligibility. However, that will not be approved. If it is approved, it will not be approved until after this application comes out. So it wouldn't take effect until I think July 1st. So it would affect if there's a next funding source, funding round of funding. So it will not affect this round of funding. But we do recognize that that's a limitation. So we are working on trying to improve that and broaden the eligibility.
I can take the next question. Someone dropped a question in the chat saying, what does affiliated with accredited institute for higher education mean? So accredited institute for higher education is a school that provides training for these students. They usually partner with a site to do that because they need a physical site in order for these students to get that required training. Manny, would you like to add anything to that? But that's pretty much my understanding of what affiliated what affiliation with an accredited institution is. And then I see another question here. Does the affiliation with an accredited school need to be located in Rhode Island? Um, my understanding is yes. It does need to be located in Rhode Island because um, because this is a Rhode Island program. However, I will let Manny elaborate a little bit more on that um, once he's available to do that.
Sam, is Manny speaking?
I don't see Manny in the webinar anymore, and I don't.
Okay.
Yeah, it
Uh,
looks like he's
but I'll
having a
give
little bit
him.
technical issues right now. So sorry.
Oh, okay.
He's trying to take it back in.
And Sam, just so I'm clear, the preceptor, the affiliation with the school or the training program is that they agree to take students from that program.
That is correct.
That's what you mean by affiliated with it. So
Yeah,
so the preceptor or the practice that's precepting has agreed to take students from URI or Brown or Bryant or wherever they're taking
mhm,
students from. Okay.
that's correct. Yeah,
Thank you.
you're welcome.
I see there's a couple more questions about the academic affiliation. I don't know if you're able to answer those, Sam.
Yep. One moment. I'm just trying to see if everyone can see the slides.
Yes. Yes.
See slides.
Okay.
Yes.
Okay. Let me. I will. Since I'm handling all these things at once. Please, just give me a little bit of time to answer the questions, and I'll make sure to do that. I'm sorry for the technical difficulties.
Okay.
Okay. I believe this is where I was.
Yes, I think so. Yes. Yes.
So, as a as one of the eligibility requirements, uh, sites must be recognized as a patient-centered medical home by the National Committee for Quality Assurance and maintain this status through June 30th, 2026. If NCQA recognition expires before June 30th, 2026, the project narrative must detail plans to maintain recognition throughout the program period. Sites in the process of obtaining NCQA recognition must appear on the NCQA approved site list by April 19th, 2025 by midnight of that day. Sites that do not meet this requirement are ineligible for funding and cannot enter into a contract with the program. So now we're going to get into award determination. So the program formula, before discussing the program formula, I just want to emphasize that the primary care training site program aims to expand training capacity by supporting preceptors and sites through grant awards. Funds awarded to eligible sites must be used to support preceptors and strengthen training capacity, which is the goal of the program. Each site can receive up to 90K per calendar year, and funding is awarded on a first come, first served basis depending on availability. The grant amount is determined using a simple formula that you'll see in the slide, which is the number of anticipated trainees multiplied by the per pupil rate. Now, for the funding rates, medical students, residents, and fellows receive 4,500 per trainee. Nurse practitioners and physician assistant to students and fellows receive 4,000 per trainee. These amounts were determined through a regulatory process and benefit cost analysis to estimate the cost of the program implementation. We carefully considered whether to set these rates equally or differently, but ultimately we did recognize that either choice would create some tension. But we do want to say that You know, some people may feel, why is this group receiving this payment, or another group is receiving this payment? But we did feel like the way we figured this out was a fair process, and I'm sure that Manny can speak to this a little bit more. The goal of this program is to support medical education at primary care sites. Any student, resident, or fellow completing a required primary care rotation as a part of their training should be included. So now we're going to talk about the grant application periods. The academic year is split into two funding periods, and we encourage applicants to request funding for both periods by providing their anticipated enrollment for each. When we refer to enrollment, we're talking about the number of training slots that a site has committed to reserving for an accredited institution of higher education. So I just want to make that clear. Period one runs from July 1st, 2025 to December 31st, 2025. And then the second period runs from January 1st, 2026 to June 30th, 2026. In the application, you'll be asked to apply the program formula, which we mentioned earlier, to calculate the request funding for each of these periods. We want to clarify that funding for sites will be based on anticipated enrollment. So even if a student doesn't end up filling a slot you initially accounted for, this will not negatively affect your funding. The invoicing process will work. I like to explain it like a credit line, but there's no interest. So thank God for that. And you don't need to pay anything back. So for example, if your site is awarded 90K for period one, that's your credit line for period one. As students come through the program, you'll invoice Rido against that amount. At the time of reservation, we understand specific student assignments may not yet be available. So there's no need to provide names right away. RIDO will accept agreements between training sites and academic institutions, reserving slots as valid documentation of enrollment. The funds provided to training sites must be used specifically to support preceptors and increase the training capacity. Once again, that is the point of the program. Training sites should use the grant funds to compensate preceptors for their involvement in training sessions, learning collaboratives, and any other activities that are necessary for implementing the program. There are also some state budget restrictions to keep in mind. For example, the funds cannot be used to cover food, beverages, gift cards, or any related expenses. In terms of programmatic activities, we are partnering with CTCRI, and they'll be present during these activities. At least one preceptor from each site must complete training in the PCMH model curriculum. Additionally, preceptors will need to participate in quarterly learning collaboratives that CTCRI will facilitate, and training sites are expected to engage in program evaluation surveys that will be developed in collaboration with CTCRI. Training sites need to select one of the following models to support preceptors and increase training capacity. So the first option is the stipend model. This is where preceptors receive a stipend for mentoring trainees, but their clinical workload isn't reduced. But the second option is called the reduced clinical time model. In this case, preceptors get dedicated time blocks specifically for training, and the funds are used to offset the reduction in their clinical workload. Lastly, is the innovative model, and that's exactly what it is. We're asking sites to be innovative. This allows training sites to use alternative strategies for compensating preceptors or enhancing training capacity based on the site's unique needs. These strategies must align with the program's objectives, and they should be clearly detailed in the project and budget narrative that is a part of the application. Speaking of the project and budget narrative, it must outline how grant funds will be used to support preceptors, strategies for expanding training capacity, and how challenges will be addressed. It should also detail efforts to ensure a positive experience for trainees. As for the site expectations, sites need to adhere to the project and budget narrative submitted in their application. They're required to implement the RIDO clinical training curriculum with at least one preceptor trained in the curriculum, like I mentioned in the previous slides. Additionally, sites must submit progress reports on trainee enrollment, completion, impact, and preceptor satisfaction. So now we're going to talk about the key steps, timeline, and requirements. I
Awesome.
want everyone to take a moment to look at this timeline. This pretty much breaks down the whole timeline for the application progress.
Okay,
So first,
Sam, I'm interrupting because I was able to get back. I apologize for the technical difficulties on my end. And I knew I was going to do these slides. So want to give you a break. I noticed a couple of questions in the chat. Well, I'm trying to get to all of them as fast as we possibly can. We'll make sure to answer them. But while you take a look at this timeline, I just want to make sure that you understand it is an ambitious timeline. So I want to put that out there. And the reason for that is because we would like to try to obligate the funds that were appropriated for this program so that work can begin. And so you're going to notice that officially the application period will start on Monday the 24th, and it'll run for approximately 4 weeks. So the application deadline is the 19th. We'll leave it all the way up to midnight, so folks can apply. And then immediately after that, we kind of go into a review and then jump right into contracts. One of the things that we want to make sure that you understand, and again, kind of the reason why we're having this now, this webinar, is because during the application process, our procurement process, which is really what governs the program, does not allow us to engage one-on-one with applicants. And so during the application process, you'll have the opportunity to ask us questions, and there's a dedicated email. But unfortunately, we cannot reply to you individually. You have to post all of those questions and responses to all those questions in an FAQ. And we plan to do that by the 9th. So the first 2 weeks of the application, people can view the application, ask questions. But also wanted to have this specific time and kind of this week to also interact with you, and if you have questions about the program, be able to have that one-on-one that will not be allowed once the application goes live. So want to make sure that is understood. And then Sam, if you kind of go on to the next slides, we'll give you some tips on how we envision this timeline actually happening. If you could proceed to the next slide, Sam.
do you see the next slide?
No, we're still on the timeline slide.
Hmm.
So the key things, as Sam is pulling that up, and again, we apologize for the technical difficulties today, is that, and this is on our website, we are asking folks to, if you haven't done so already, just double check that you have registered with the state as a vendor. That process takes about 3 weeks. And it's important for us to be able to contract with you. Let me put it another way. If you apply to the program and you're eligible and you can get awarded, we cannot issue a purchase order because we will not be able to find you in our system. So that will limit us, to have the ability to do the financial transaction part. So that is huge. So I would say, please check out the website. There's information with a help desk I think it's all there. If most of you may have already done business with the state and you're already there, so it's just a matter of just double checking that your site is there. If not, go ahead and just complete the application. You have to provide your tax ID for your business, um, and make sure that you're registered. That will allow us to be able to contract. So because it takes 3 weeks, and you can see how the timeline works. That's why we're making sure that people know that ahead of time. The other thing is that for sites that are awarded, there are some insurance requirements. So if you are awarded and you are provided a contract, the other part is that there has to be some liability coverages that you're going to have to provide. And so we want to make sure that you are aware of those. And it's not a requirement that you do that right now for applying. This is just kind of giving you the heads up of what's going to come, because when it's time to do paperwork, we want to make sure that you are aware of what we're going to ask of you. And that will require you to go to your business insurance liability coverage folks and get a binder that has RIDO as part of that binder. The uh, commercial liability limits are like 1 million per occurrence. There's obviously auto liability, workers' compensation, professional liability. And again, these liabilities are things that you already normally carry in your business, but because you're going to be doing, in essence, work on behalf of the state, you want to make sure that you know that that needs to be done. It's just, again, part of the paperwork that needs to be trailed at the end. Um, Let me see if I could well, if I could try to share my screen real fast, and hopefully this doesn't break again. And we can go from there. Can everybody see this here, the slide that I'm in? We'll go on this view just so that hopefully it doesn't freeze everything else up. But this is what I was talking about in this earlier section, where you have to register with the state of Rhode Island. Here's this information is already on the website. Here's the email address where you can ask, the phone number, and the registration portal itself. Um, and again, this is what I was referring to. In terms of the key steps, you're going to apply, but as you get here, you're going to have that insurance binder. You're going to have that be in our system so we can actually provide you with a purchase order. So that's why we want to upfront those steps as we're trying to be ambitious in getting to June and the close of the fiscal year. And again, these are the requirements here. Again, not required for you to apply, but we just want to let you have advance notice that we're going to ask you to have that document. So if you're thinking about applying, it might be good to start talking to the person who holds your insurance. So next, Sam, do you want to take this away?
Can everyone hear me?
We can hear you. Awesome.
Okay, awesome. Okay, so now I want to walk you through how to apply and navigate the 2025 Primary Care Training Sites Program application. As I mentioned earlier, the application will be available on the PCTSP webpage and RIDO's Request for Proposals webpage starting on March 24th. In the application, you'll be asked to provide some general information about your primary care practice. There's also an eligibility screening section. I touched on this earlier in the presentation, I believe. But just as a reminder, applicants need to meet all program criteria to qualify. Think of this section as a soft eligibility check. It's an opportunity for sites to reflect and assess whether they meet the requirements. Completing this section won't prevent you from moving forward with the application, but only eligible sites will be able to participate. If you're unable to answer yes to all questions, it is a good indication that your site may not be eligible. Next, you'll provide some details about the key personnel involved in clinical training. This includes your lead preceptors, admin support, and any additional preceptors involved in the program. Then there's the funding request section, which I spoke about earlier when we went over the program formula. You'll also complete a use of funds section outlining how your site plans to use the grant funds, which we also discussed previously. Additionally, we want to ask for your site's current operational challenges and needs for expansion. This is your chance to share any barriers you're facing and how this funding could possibly help. There's also a readiness assessment for implementation to gauge how prepared your site is to participate in the program. And finally, you'll complete the certification and signature section to confirm your application submission. Next slide. Okay, so here's an example of how the application will appear on RedCap. You'll see that this is not the actual application, but it does serve to kind of show you what to expect. So you can see the layout design, including the navigation bar and the save and return feature. So if someone from a site is filling out the application and happens to forget their return code, they can reach out to the PCTSP staff using the email address located in the bottom right corner. Just keep in mind that this is the only point where during the application process when sites will be able to communicate directly with us. Next slide. With that being said, if you have any questions about the application, you'll need to submit them by email to rido.primarycaretraining@health.ri.gov. Please make sure to use PCTSP application question as the subject line so your question is routed correctly. The deadline to submit any questions is April 4th, 2025, and that is by midnight of that day. Rido will compile all the questions and post responses by April 9th, 2025 on the Department of Health's Request for Proposals webpage. You won't receive a direct response to your question, like I said earlier, but you'll be able to check the website for all the answers. Also, just another reminder that during the application window, Department of Health staff cannot respond directly to applicants. So if anyone on this webinar has a question that they have later, they can send those questions to this email, and we will respond to those questions by putting it on the request for proposals webpage by April 9th. Next slide. Okay, so the application review period kicks off on April 21st, which is actually my birthday. So that's a great birthday gift. Award notifications will be sent within about 3 weeks after the application deadline. So applicants can expect to hear back relatively soon. If you are awarded, you'll have 1 week to accept the offer. But don't worry, even if your application isn't selected, you'll still receive a notification from us. Keep in mind that any incomplete or ineligible applications won't be considered. So double check everything before submitting. Next slide. Okay, so we're gonna go over the contract and compliance. Awarded applicants will contract with Rido before commencing work. Sites must contract with Rido and be fully registered in the Ocean State Procures system to receive a PO, as we mentioned before. They would also need to provide proof of student enrollment required to receive payment, and that is your anticipated enrollment. Um, Invoice documentation needs to include reserved slots, the disciplines of students, academic institutions, and training period details. And the payment will be based on the number of enrolled students and per pupil rates with no carry forward. Next slide. So anyone who would like access to this slideshow will be given the resources. So that includes the web page for this program, the email address to ask any questions that you may have. If you would like to learn more about the Office of Primary Care and Rural Health, we provided a link as well. If you want to find out if your site is listed as a patient-centered medical home, we also provided a link that will be able to tell you through a list. And you can also learn more about our partner CTCRI and also the authorizing statutes that make this program possible. Next slide. Awesome. So now we can answer any questions that we may have not already.
So yeah, I want to address. I know that there's a few questions in the chat, so I want to address some of them that I think I may be able to get a few of them off of uh, a couple of words. So the first thing is about the program design. So the program was designed as a non-competitive solicitation, right? That's based on a formula. So that means that not one site is competing against the other because we want to provide awards to everyone who meets the eligibility so that everyone can get the funds available. And so for that, our procurement process within the state allows for a non-competitive solicitation that's based on when as individuals apply as first come first serve. And so we were able to choose that selection to be able to get the money to the community as fast as we possibly could. That basically means if you checked all the boxes for the eligibility and you applied, and we had the funding, we would provide you with the funding until obviously the money runs out. That is why it's on a first come first basis. So when you apply to the program and you hit the submit button on the application, it'll record a timestamp, and that timestamp is what we're going to use for prioritization. And there's a few questions related to that. There was also another again a question about the PCMH. Again, unfortunately, the PCMH part is something that we recognize that there are various organizations that certify folks as PCMH, and that is something that that we're limited by because the authorizing statutes say that, and it's like for verbatim, I may not be quoting it directly, but it says that the eligibility is NCQA, PCMH recognized. Because of that, it really narrows the scope, and it's something that we're working towards addressing through legislative action. So I apologize about that because that is something that uh, limits us, and we've learned that some are moving to other uh, uh, recognition statuses. So we apologize about that. Um, let's see. The other things that come up have been about the being registered in the Ocean State Procurers. There is not a particular database that's publicly available who is in the system and who is not. And so for those, if you have a question about if your individual site is on it, I would encourage you to reach out to the help desk, either by email or by phone number, just to confirm. It doesn't hurt if you start an application, and what they'll do is that on the back end they'll say, "Oh no, you already have one," because they'll look at your tax ID for the business and be able to say, "Oh, we have something already here. Is this an update? Are you trying to do like an update?" Because some of the vendors have to do updates, or is it that it's a complete new entity? So, unfortunately, that is a limitation. But we wanted to make sure that you had advance notice. Um, for it. And then the last kind of question that I'm triangulating from all the things that are in the chat It's about preceptors and students, and how some preceptors precept all the time, some preceptors, if they're affiliated with a school, etc. So I'm trying to capture all that. So to answer, kind of address those questions all at once. Um, the preceptors, we want to know, because we don't know ultimately what level they divide their hours, right? So some may be providing direct care and also precepting and doing research and other things. Some may solely do precepting the entire year. So we want to know that. In the application, there'll be a section in which we're going to ask you, who's your lead preceptor? And then in addition to that lead preceptor, who are all the other preceptors that are within that practice or that participate in that practice? And we want to really know that, because that is part of the unknowns. We really don't know the total capacity for training in this for primary care. And one of the things that this program will do is, one, hopefully give us a baseline to kind of understand what's happening, and then also hopefully we can see that the program will have an effect in increasing that capacity. And increasing that capacity, just for talking out loud, can be either that you're taking additional students, or that based on the model, so that preceptor now has more time to mentor, right? So I don't want you to limit capacity to thinking of just like, increasing numbers, because of that. I was a former high school physics teacher. You have more time with that student. You're able to create relationships and allow them to really understand not what the subject matter they're teaching, but how to apply it, and then see the value, right? Creating those theory of planned behavior, the intent to want to practice in primary care, the intent to want to stay in Rhode Island, right? So those are the things that we're looking for when we think about capacity. So I hope I tried to address most of the questions that are there. And obviously, this is your time. I want to make sure that you can ask us questions. So please feel free to raise your hand, get yourself off mute, and ask away. And actually, before I do that, if I give if Jolanda or Dr. Flanagan, you want to give 2-3 minute update on curriculum learning, that whole work that you guys are working on.
Sure. Thanks, Manny and Sam. I think part of this legislation also was about a sort of standardized curriculum, advanced medical home. This is not a curriculum that is for any one discipline. It is an overlay to the curriculum. That is, if I am in a pediatric practice, the pediatric training program may have a curriculum or certain things that I need to be teaching when I have the student. This is really meant to overlay the curriculum requirements by any given training program for the specific type of trainee that you are hosting in your primary care site. This is will be hosted on the Department of Health website. It is in development. It will be 5 modules, much of it self-learning, and there will be um, uh, an orientation to the curriculum for preceptors, and sort of uh, to have an understanding of what this curriculum is and how to use it as you are going ahead with your on-site clinical training of trainees. So it is in development. Again, it will be 5 modules, and there will be an orientation to it. Likely in July, we may have 2 sessions, just given that it will be vacation time for a lot of people. And then we will have quarterly learning collaboratives for the preceptors who are involved in the program, really to talk about clinical precepting, and to, any challenges that are coming up, any issues with the trainees, or is there a desire for some didactic training for the preceptors?
Awesome. Thank you, Dr. Flanagan. Again, the CTC has been a great partner, so we appreciate all the work that you guys are doing. I do acknowledge that there's some folks that have their hands raised. So, Sarah, if you can just be on mute and state your question.
Hi, yes. So we are a primary care practice that has 2 different sites, and we have more than 20 primary care doctors who are very interested in being involved. We are one practice with 2 sites. Can we count that as 2 separate sites? We all have the same
Correct.
TIN number.
So yes, it would be two
So is
sites
that
because they're physical locations.
okay? So it's based on physical location.
Yep.
And then my second question is, I'd really rather not pick one track to be in because we are in the process of developing an innovative curriculum that we have implemented once already, but we also have multiple preceptors who are using a more traditional model. Do you have to pick one, or can you be involved in using the funding in all of those three different ways that you'd specified?
So I want to make sure I'm following your question. So you can you have to pick one model
Okay.
to implement. So whether it's the a stipend model, the reduced time model, or you get to kind of make it your own. There's an innovative model that we just want to know how what works for your practice. So if in your case, Sarah, if you have two practices, and let's say in practice A, maybe the stipend model is the way to go, and maybe for stipend B, you kind of have to switch it up a little bit and say, hey, I'm going to maybe combine the two and make it a stipend and a reduced time model. Then yeah, you would do it based on the site. Now, in terms of the curriculum, because that's where I was a little bit confused. There is that curriculum Dr. Flanagan was mentioning that will have to be implemented. So at least one of your preceptors for each site would have to
Okay.
go and get trained on that and be able to implement it and also participate in learning collaboratives.
Okay, and is that two separate applications?
So when you apply to the program, and in your case that you have two individual sites, what we're going to ask you to do is to apply for the first program, and additionally the second program. Now,
Okay.
because the preceptors are going to be different at each site, we want you to separate them that way, right?
Okay, great.
If and so that way we can have a contract for site one and a contract for site two.
Great, thank you so much.
No problem. And then Pamela, Dr. Harp, I apologize.
Yeah, hi. I just wondered about the requirement that's in just 90,000 per site, because it seems like if you have a site with a lot of doctors, they could all do it, but now you're limiting. So if you have a site with 10 or 15 doctors, they could get 90,000. If you have a site with one doctor, they could get 90,000. It doesn't
Right.
seem really fair or a good way to get a lot of people to participate.
So yeah, so the 90,000 came from the law that authorized this program, and they set a limit, 90,000 per site per calendar year. And so what I want to reiterate is there's two calendar periods in the academic year. There's the end of this calendar year, the 2025 calendar, and then there's the beginning of the calendar. So I say that to you so that when you're looking at your enrollment, you account for that, and also the enrollment is based on the anticipated number of students, not the preceptors or number of preceptors that you have. So you can have, let's just for a pretend scenario on one site, 15 medical doctors and residents and fellows, the combination that gets you that 4,500 category, and let's say another 30 or 40 PAs, NPs, right? Just a quick math, you're going to be over the $90,000, right? So you automatically get that 9,000 for that site. So I want to make sure that it's understood that the compensation is not necessarily for the number of preceptors, but necessarily by the students. And one of the things that we did, I don't know if it was mentioned because I had a technical difficulty, is that we understand that some programs, some residency programs, and some preceptor programs, the school may not necessarily pay for that site, for that placement. And so we look at this as a way to kind of help offset that. I know some programs, as a student, you pay for the rotation, and some you don't. So we want to allow sites as maximum flexibility in doing that, and that's why we were very kind of allowing the sites. You let us know what works for your site in the compensation model. We're going to look at it based on the students that you intend to take on, because we know that you still have to have those resources, even if that student doesn't show up because they may withdraw from the class or drop the class, or something happens that in their life that they cannot attend. So we wanted to be very flexible to allow the sites to really, again, have the money because we know they need it, but also at the same time tie it to capacity, which is either students in the seats or time, which is what the preceptor will provide. And then Dr. Holm.
Thank you, Mr. Ortiz. I think the one thing that might help a lot of people, by the way, great presentation and a great program, is just clarifying sort of the per student stipend. What is a student? Is it a student for 6 months? Is it a learner for 6 months? Because depending upon what profession you're in, what stage in your professional education you're in, it might be a 4-week rotation, it might be a 2-week rotation, it might be a year-long rotation. So I think people would really help to understand what the actual compensation is if they understood if it's per student per month that you can draw down and they have to be there for 4 weeks, or if it's every by week. Just if you could clarify that, I think it would help. And you don't necessarily have to do it now if you're out of time, but on your website at least. Thank you.
You know, I could certainly do that. And I appreciate that. We could definitely add that to the website. It's per student, and the student can be there for a week, 2 months. It's a stipend for that student for that spot that you're holding. So that student can be there for whatever is required of their rotation. And again, the design here was that we needed to create a formula base that's non-competitive that everyone can get until the money runs out. So it was creating a flat rate for that student was the easiest solution, and not tie it to the amount of time that they're there. So we appreciate that feedback. And in developing this is one of the things that we kind of went back and forth. But again, to ensure that the money can get out to the community as fast as possible, this was the fastest procurement mechanism to do. So yeah, the student can be there for a week, for 3 weeks, whatever they're required to be there, and that would be the stipend for that student for that slot. And then Dr. Harp, do you have another question? All right, so I think she just left her hand. All right, so obviously, we're up for time, and we appreciate everyone's, taking time out of their day to come and join us during lunchtime. You have our contact information. If you have any questions, please feel free to connect with us this week to make sure that we answer all of your questions. We're going to post all of this online. I have to apologize for the technical difficulties that I had on my end. I hope that didn't create any confusion about the messaging. But we appreciate the questions. We're going to go through the chat, and we're going to make sure that we address all those questions and that we provide all those resources online so that you have it. And in the meantime, if you have any questions or want to set up some time with us, please feel free to reach out. Sam and I are always looking at that email address, and we could always connect with you to make sure that you feel comfortable and understand what you're going into before you apply to the program. And we hope that you guys apply, that we hope that you guys take advantage of the opportunity. Well, thank you.
Thank you very much.
Thank you.
Thank you.
Thank you all. Great program.